Production and broadcast costs for Sedgwick County Commission meetings have been underwritten by Sedgwick County. KPTS welcomes comments from the public on its broadcast of the County Commission hearings. Viewers are invited to write to County Commission Broadcast, KPTS, 320 West 21st Street, Wichita, Kansas, 67203.
Good morning. I'm Christy Zukovich. Welcome to the March 11th Sedgwick County Commission meeting. We're glad you're joining us today. And, of course, we always use this time to let you know about things going on around Sedgwick County. And we know that spring break is coming up for a lot of students in the next week. And, of course, if you're looking for something to do with the kids, you might take them to Exploration Place. They do have a new exhibit. It's called Wildlife Rescue. And, of course, then once you get done at Exploration Place, you can go out to the zoo and enjoy some real wildlife exhibits. So always good, and hopefully we'll have good weather to do that. We would remind you that at Intrust Bank Arena we do have Disney Princesses on Ice, and that is March 12th through the 15th. And we do have coming up March 31st a flash from the past. Commissioner Norton, can you give us a shout out? Do you know who's coming March 31st?
Well, there's several people coming, but Stevie Nicks for sure. Fleetwood Mac will be at Intrust Bank Arena.
Fleetwood Mac is coming. I know that you have been long waiting for them, so we're gonna check back and do a little review with you to see what you think.
Susan and I will be there. It'll be my 5th time to see them.
Okay. Well, we'll check back after March 31st to see how it was. Commissioners, we do have a special guest today to tell us. I tried to make something really, quippy out of it, and I couldn't come up with anything other than it's Tag Wednesday. So we're going to hear from Linda Kazire, our Sedgwick County Treasurer. She's going to tell us about some new tag options that we have.
Thank you, Christy. Thank you, Christy. Good morning, Commissioners. Another new plate, Donate Life. It's sponsored by the Midwest Area Transplant Network. We have more than 2,600 people in the Midwest Transplant Network area waiting for a life-saving organ. The number of candidates vary from kidneys to eyes to tissues, and this is a way for them to raise money to support and let people know the importance of donating their organs at the time of their demise. It's very easy to sign up. You can do it when you renew your driver's license. You can do it online at their location. There's a $40 fee that is tax deductible that is paid at the time of purchase for this plate that goes directly to the Midwest Transplant Network. And there's also the $46.50 Kansas Department of Revenue fee, plus your regular registration fees and taxes that we have to have. One organ and eye or tissue can save more than 50 people. And from personal experience, my mother has had both corneas replaced in her eyes. Without the donation from someone else, she would not be able to see. And so I strongly encourage people that are interested to please visit one of the 4 tag office locations, and let's donate life.
Thank you.
Any questions? And it's really pretty, too. All righty. See you in a few months when we get another new one.
Thank you.
Thank you, Linda. And Commissioners, I have one last thing that I learned. I don't have any quiz for you today. I'm not going to put you on the spot, but I have one last thing I want to make sure you know about this for Saturday. March 14th, while you're sitting around watching the Big 12 tournament, this is where we say, "Go K-State." Right, David? Go K-State.
Okay, stay.
Which David are you talking to there?
Maybe just today.
While you're watching, though, on Saturday, March 14th is National Potato Chip Day. So get you a big old bowl of potato chips, sit down with the game. You can't go wrong. So we have lots of important business on our meeting. Not a lot of items, but important items. Commissioners, we have some folks here this morning who will be appointed to your boards, your advisory boards. We also have a consideration of grant for supported employment for ComCare, and we have a consideration of a grant for a number of health services for our health department. But I think that's all I have. Chairman Ranzau, I bet you can get the meeting underway.
Absolutely. Thank you very much, Christy. With that, I'll call to order the meeting of the Board of County Commissioners for March 11, 2015. Madam Clerk, first item.
Invocation to be observed by a moment of silence. Please remain standing for the flag salute.
Amen.
Pledge allegiance to the flag of the United States of America and to the republic for which it stands, one nation under God, indivisible, with liberty and justice for all.
Next item, please.
Roll call. Commissioner Unruh.
Present.
Commissioner Norton.
Present.
Commissioner Howell.
Present.
Commissioner Peterjohn.
Present.
Chairman Ranzau.
Present. Next item.
Appointments. Item A. Resolution reappointing Kelly Grant to the Sedgwick County Community Corrections Advisory Board.
Good morning, Richard Houston, County Councilor. Commissioners, we prepared this resolution of reappointment for a term of 2 years, and I recommend you adopt the resolution.
Commissioner, do you have any questions, or do we have a motion?
Move we adopt the resolution.
Second.
Madam Clerk, call the vote.
Commissioner Unruh.
Aye.
Commissioner Norton.
Aye.
Commissioner Howell.
Aye.
Commissioner Peterjohn.
Aye.
Chairman Ranzau.
Aye.
Good morning. Good morning. If you raise your right hand and read the oath, and you can say I do at the end. I do solemnly swear that I will support the Constitution of the United States, the Constitution of the State of Kansas, and faithfully discharge the duties of the office of Sedgwick County Community Corrections Advisory Board, so help me God.
I do.
Thank you.
I just wanted to say really quickly, thank you so much for this appointment. A reappointment. For the past 17 years, I have worked in the criminal justice field in some capacity, and I'm very honored to accept this appointment. It means a great deal to me to serve on this board, having worked for this department previously in my career. I never thought I'd actually be able to sit at the table, so I'm humbled and thankful to serve for another 2 years. I continue to be impressed every month that I go with the Department of Corrections initiatives to primarily protect our community and also to assist offenders in becoming productive citizens. Since most of our offenders will remain in our community and return to our community under supervision, it is really imperative that we continue to focus on what works to support these efforts. Thank you for the opportunity to continue serving on the Community Corrections Advisory Board. Thank you.
Thank you, Kelly, for your willingness to serve.
Thank you.
Next item, please.
Item B. Resolution appointing Dr. Julie Evans to the Sedgwick County Animal Care Advisory Board.
Commissioners, this term on this board is for 4 years, and we prepared a resolution that I would recommend you adopt.
Commissioners, I'd like to move that we adopt the resolution.
Second.
Madam Clerk, call the vote.
Commissioner Unruh.
Aye.
Commissioner Norton.
Aye.
Commissioner Howell.
Aye.
Commissioner Peterjohn.
Aye.
Chairman Ransall.
Aye. And I don't believe Dr. Evans is here today, so the clerk's office will catch up with her at a later date. Next item, please.
New business, item C, consideration of a grant in the amount of $290,941 for enhanced supported employment of Kansas.
Good morning, Commissioners. Marilyn Cook with ComCare. Before you is an item that is asking for your consideration of a grant of $290,941 for 1 year with the option to renew for 1-year periods. The grant is called Enhancing Support Employment in Kansas, or ESEK. The Kansas Department of Aging and Disability Services, KDADS, is the actual grantee. The purpose of the grant is to expand the evidence-based practice of supported employment to individuals who have a serious illness but who are also uninsured. To this point, this evidence-based practice was available only to individuals with a serious and persistent mental illness who had Medicaid coverage. KDAD selected 2 community mental health centers, ComCare and the center in Garden City called Compass, as the implementation sites for this demonstration grant. Both of our centers were selected for our experience in delivering supported employment services to people with serious and persistent mental illness, and due to the substantial number of uninsured individuals living in our respective communities. Many centers throughout the state have not been able to maintain this evidence-based program for supported employment due to the associated administrative costs, lower caseloads than are asked for traditional case managers to carry, and other constraints needed to maintain fidelity to the model. In addition to expanding the target population of this grant and adding peer support workers for the first time to this activity, another key purpose is to identify barriers to implementation of this evidence-based practice and to determine a rate for this activity that would enable community mental health centers throughout the state to implement and sustain support employment practices for this population. We know that the support employment evidence-based practice worked, and we have experienced success in the past with this. It is dramatically different from the older, more traditional approach to helping people with mental illness become employed. This is a demonstration grant, so that means research is involved. KDADS has contracted with KU School of Social Welfare to lead the research, to monitor our progress in meeting fidelity to the model, and to help course correct as needed. Another condition of the grant is for both community mental health centers involved to establish and convene a local advisory group to meet and provide input, as well as offer suggestions for program improvement and to help monitor our progress and be part of that dialogue. The grant will pay for 3 full-time employment specialists, 2 part-time peer support specialists, and a half-time manager for the program. I do want to point out that this item also includes technical adjustment to the ComCare staffing table, as we cannot supplant current positions with this grant. So the technical adjustment adds 6 new positions and eliminates 6 positions from the ComCare staffing table. We're expected to serve a minimum of 25 individuals in this new target population, year 1, and 50 new individuals in each of the following years. We are also allowed to have our support employment specialists carry a small caseload of individuals who do have a severe and persistent mental illness and who have Medicaid to cover and that cover that service as well. In summary, I just want to say that we are not asking for money. We're asking for your support for this opportunity. This target population is a population whose mental illness symptoms keep them from fully functioning in relationships, in finding safe and affordable housing, in making healthy decisions, and often in finding and keeping jobs. So we do know that nationally, 10% of people who have a serious mental illness, only 10% of individuals with a serious mental illness have employment, and that with the use of an evidence-based practice nationally and here locally in this community, in ComCare, between 40 and 50% are able to find and maintain employment. The other thing that is pretty critical is participating in this grant allows ComCare and Compass Mental Health to participate with the state in identifying barriers to this evidence-based practice and to settle on a rate that is sustainable. And that's been very critical for us. So our recommendation is that you approve acceptance of the grant, authorize ComCare's executive director or their designee to electronically sign the grant agreement, implementation of the staffing table changes identified in the personnel considerations section of this request, and authorize the establishment of budget authority as provided in the financial consideration section of the request. And I would stand for any questions.
Commissioners, are there any questions? Commissioner Peter John?
You mentioned KU is going to be taking a look. Is part of the grant going to be involved in terms of any transportation between here and Lawrence, or is it strictly for personnel and directly for the program in terms of, I mean, is part of the grant going to be paying KU for the oversight or research they do on this program?
The grantee is KDADS, the state, and they're the ones that are contracting with KU for the research. KU has already been in phone contact with both of our sites, and they will be making site visits. We won't be going there. They will be coming here. Part of an evidence-based practice is to have this research team come to the sites, and we've been doing this for a while when we were engaged in this practice, review records, meet with the team to make sure that we are following and meeting fidelity to the model, reviewing for themselves our statistics, but they travel here. We don't travel there. And KDADS will be the one as a grantee that will travel to the national, whatever national meetings that would be needed by SAMHSA for this.
Commissioner Norton?
Marilyn, this is a one-year grant with 4 renewables after 4 years of renewables.
Yes, sir.
Is the money coming out, all of the money coming out of the state?
The money is coming from the state through SAMHSA.
Okay. And where will you get this population? Where will you find these individuals that will need this care and help?
That's an interesting question. ComCare serves, as you well know, a very significant number of people with severe and persistent mental illness. But we also serve a large number of individuals in our outpatient program that have a serious mental illness. A couple of years ago, when I looked at the statistics on how many people who were coming to us in our outpatient program with a serious mental illness but not serious enough to affect their functioning in order to be eligible to have a case manager, we had about 600 individuals. Very few of them were working. We will have no difficulty at all finding these individuals.
Who are the other partners out in the community that will work with this? Obviously, you're going to have employers to be able to find employment. Do you have partners already lined up?
You know, we do.
Thought about that?
We do. We had done this evidence-based practice for a while, and our community's been really wonderful in supporting this support employment project in the past. We have had individuals in the SPMI evidence-based practice get jobs at First Student, at Walmart, at Dillon's, at Kentucky Fried Chicken, Church's Chicken, McDonald's, Target, JCPenney, Subway, Rest Care, the Mental Health Association, Dollar General. There's a whole list of them. And why this is important is that this new evidence-based practice is individualized. In the past, our focus was on getting people with serious mental illness connected to a job, and those jobs were often in the fast food industry and in housekeeping. And so the new approach is an individualized one, and in fact it has a new name. They don't even call it support employment anymore. They call it IPS, Individual Placement and Supports. So the model is real different. There is quick assessment, there is quick job search in jobs that these individuals want. There is zero exclusion criteria. So if someone says, I'm ready to work, we're going to do our best to get them a job. And we've been successful at it.
And the peer counselors will show up at their workplace and make sure that everything's going well at the workplace once they find the employment.
Yeah, and in the model we've been doing to this point, the employment specialists were doing that. When individuals start jobs, they need a lot of support, and so sometimes the support employment specialist meets them at lunch. They don't do what we used to do, and that is if those folks don't show up for work, they do the job. We don't do that. You know, these individuals have to maintain and take responsibility for the jobs that they have. But they do talk to them about any problems that are on the job. They talk to them about any questions or concerns they might have. They encourage them to stay on the medications they're on. And to help them problem solve in general. I will say for the folks that we have been serving in this, a number of them have advanced to positions where they're starting to do things that are really new to them, like traveling overnight for a job. And, you know, that's a whole new world for some of these individuals. And many of them, due to the symptoms that they have, can have problems with peers and colleagues in these jobs. So some of that is also talking about how you get along with the people that you're working with.
So most of the peer counselor's time will be with the individual, not advocating or monitoring through the company.
Oh, absolutely.
Through the individual.
Right. They will be connecting with individuals, and part of the supported employment specialist job is to do job development. So they are helping introduce these individuals to employers, but they're also, you know, if someone wants a job that we don't already have a connection with, part of their job is to reach out to different employers who offer that kind of job. So there's a job development piece as well. Peer support workers will not be doing that. They will be focused on connecting with individuals that we're serving.
Well, I like this model much better. I have some experience with that with Target, with not only mental health but disabilities, and that advocacy role almost got in the way of the employer and the employee. And this looks like it's more centered on the employee and not trying to advocate something different for the employer. I think that's good. That's good.
Absolutely.
Okay. That's all I have, Mr. Chair. If there's no other questions, I'll make the motion that we take the recommended action.
I will second.
Okay, before we go any further, I want to ask if there's anyone from the public who'd like to speak on this item, because I forgot to at the beginning. Seeing none, we'll continue. Just one clarification. You said this money comes from the state, but originates from the federal government.
Yes, sir.
The state's not funding this.
The state is?
It's pass-through dollars.
Yes.
Got it. Commissioner Howell.
Thank you, Mr. Chairman. Can you describe the population? You said severe and persistent mental illnesses. Can you describe that population? What are we talking about here? What type of illnesses is your population you're trying to assist?
Okay, severe and persistent mental illnesses are mental illnesses that are illnesses such as schizophrenia, bipolar conditions, depression, anxiety. The severe and persistent part of that is that their functioning is so low that they need help negotiating and navigating the community. This grant goes another level to people who have those same diagnoses, but they are not eligible for case management supports in the community because they have been able to function at a little bit higher level. Does that help you?
A little bit. So your role with respect to the employer that may or may not, it has a decision to make to hire this potentially this potential employee, are you allowed to talk to them and tell them about this case and explain to them the problems and needs of this employee that they might want to hire? Are you allowed to talk to them about their depression or their schizophrenia and their bipolar and things like that?
Depends on the consumer involved. We encourage them to divulge the fact that they have a mental illness in case something goes south on the job. They don't have to. And so when they do, we do work together with the consumer to share any constraints or concerns that they might have about the individual. Some people choose not to divulge that because for fear that there'll be consequences with that. And in that case, we don't. They know that these are county employees coming to them for employment opportunities for people that have some type of disability. So it's a yes and no answer.
So in every case, you do have some connection to the employer. And you explain to them why you're there.
Absolutely.
Okay, I understand. How many of these folks do we actually continue to monitor and continue services into the long-term future? I mean, do we help them with getting the job, and then what's our role and responsibility for the long-term? So for a month or 6 months or forever, I mean, how do we continue that service to these folks?
You know, the answer is, again, individualized as long as they need it. In the old model, we would be in there for a short period of time and then out. One of the criteria in this new model is that not only do we not exclude anybody that wants a job, but we offer support as long as they feel and articulate the need for it.
And how long have you guys been doing a program similar to this?
Oh, a little over 10 years.
Okay, so do you have any data we could look at that would show you did mention some statistics, but I'd like to know within that population, for example, you know, if you're able to summarize and say, you know, people who have schizophrenia, we've employed, you know, however many folks or a percentage of these folks, and they've continued employment for some period of time, or other types of mental illnesses. In fact, I think you and I had a private discussion about this, and you talked about ADD and ADHD and PTSD and some other things there as being some of the population that would benefit from this. And so I'm just wondering, do we have a breakdown of the success of this program for the last 10 years or any type of data we can look at?
Commissioner, I did send you an email that outlined that, and I thought I brought it with me and had it tagged. So, well, and I just read to you from it because that was the same sheet that I talked about the different employer groups that we were contracting with. Here it is. So in general, and we don't have it by diagnosis. I could get it to you, I think, by diagnosis, but that would entail us going into the record and doing a different kind of sort. But basically, ComCare served an average of 156 consumers every year in the support employment program we have. We currently have 4 full-time employment specialists. They continue to see about the same number, the 4 of them, 156. So that number will go up with this additional staff because people do go in and out of that program. On average, 41% of the program, those in the program were able to obtain competitive employment, which again is a very critical part of this. On average, in the past, 19 consumers started a job each quarter while they were in the program, and then I had provided you with a list of employers that had helped us. I didn't read all of them. The list is really extensive, and we have been applauded by the state for the kinds of connections we have with local employers.
And so whether we accept or reject this new expansion of this program, that will continue, that effort will continue on that we're already doing.
The support employment that we have currently, yes, but we will not be able to extend that to people who have serious illnesses who are uninsured.
So is this the first time we've ever looked at this particular grant, this expansion of this program? This is an ESEK grant. Is this the first time we've ever done this type of a grant?
It's the first time we have extended a grant to a population with a mental illness that didn't have a payer source.
But this just marries right into what we're already doing. So basically, it's expanding our current.
Yes.
Can you explain why would we have to eliminate 6 positions and add 6 new positions? I don't understand the point of that.
Well, I wish someone from finance were here, but our understanding is when you get a grant of this type, especially if it's federal pass-through money, they do not want you taking that new money and then using it for positions you already have. So we had 6 vacant positions, and the difference is we will eliminate those positions and position numbers, add, if approved, these positions, and then at the end of this grant period in 5 years, if it's not sustainable, those individuals will no longer be doing this work.
Okay. You also mentioned that this is one of 2 locations in the state, Garden City? Garden was the other location. So do we have a region that we're trying to service that's larger than the city of Wichita or larger than Sedgwick County?
No, it's just Sedgwick County.
So what do people do if you're in El Dorado or someplace? They don't have this type of support there?
Well, all mental health centers have some focus on support employment and getting the consumers we serve employed, because it makes such a difference in their lives, and it helps make them more fully function in the community. A number of us, ComCare included, were using this evidence-based practice. We stopped it 2 years ago. We stopped the fidelity to the model. I want to be clear about that. We continued with the new approach and all the elements in the tools that were expected, but we didn't do some of the other things that were administrative that were too costly. So we gave the state notice a year and a half ago that while we believed in it, we were going to continue to provide these services, but we were not going to meet fidelity because it was costing us near a little over $80,000 a year to do that. And until the rate was sufficient, we weren't going to continue. And I think they appreciated what we did. They liked our outcomes, and they recognized that the rate for this is only $6 an hour more than regular case management rate.
Okay. And then I guess I think my final question is this population considered IED or DD population, or they're not classified as either one of those?
There may be. We have a shared population. There may be some people in there that have an intellectual and developmental disorder. I would guess that probably not too many of them would, because those individuals require a little bit more support, and they would probably be eligible for case management if they had those co-occurring disorders. So probably not many of them.
So let me ask then, who determines that these people have a severe and persistent mental illness? Who makes that determination?
Our staff does, and it's based on a list of diagnoses. It's based on a functional assessment, and it's based on risk factors. And it's everyone in the state is using that same tool.
I guess I do have one final question. I'm sorry, added to that, but is there some duplication of effort? Does the Workforce Center here in Wichita, does it do some of the same types of stuff trying to, maybe not the follow-on work, but the connecting these people with job opportunities? Do they already do that type of work?
Not with this population.
Okay. All right. Thank you very much.
You're welcome.
Marilyn, I have a few questions on based on our conversation. I'm a little confused. I think you may have clarified it. We've been participating in a program that's similar to this for a while.
For adults with a severe and persistent mental illness, yes.
That have actually more problems than the group we're trying to help now. The group we're trying to help now is more functional.
Yes.
Okay.
You got it.
And we stopped, I thought we stopped that program, but we didn't stop.
We continued with the tools because they made a lot of sense to us, a lot more sense than the traditional way of providing services. What we didn't do is have complete fidelity to the model. And part of the reasons for that, Commissioner, is that when managed care organizations came into the picture in 2013, they started putting some limits on the number of hours that we could provide for this code for helping people. And it's the same code that we use to provide direct services to individuals. So we got to the point where it was really hard to maintain fidelity to the model. We also had a period of time a couple of years ago when ComCare had a high turnover rate in that particular program of case managers. And part of that, I think, was because the original case managers who were doing this had not really had a lot of experience in job development and making cold calls. That's a kind of new skill, and we tried to skill them up. Some didn't want to do it. They wanted to work with the consumer, but not do that marketing job development piece. So there was a time, there was a turnover in that program, and that's happened throughout the state. And so other case managers, we had to shift so we could cover all the people and the caseloads that were uncovered. So we did, some of the individuals that were doing support employment also started doing other case management activities, and that was against the model. So the key tools in that model, the key strategies and principles, we even continued to keep data. But what we didn't do are some of the administrative things.
Well, is the state still funding that?
The state still funds it, yes.
Still funds it.
We just don't get the enhanced rate of $6 more an hour.
I see. And we just don't do the administration. And how many people do we have doing this?
We have 4 people doing that right now.
Okay. And
by the way, the hope is when we get this grant and work with the state, we will identify a rate that is sufficient and identify barriers so that we will once again meet fidelity to the model in a way that doesn't cost this county money.
why don't we want it to cost us money?
Pardon?
Why do we not want it to cost us money?
Because we want to be able to provide this service to people, and we can't provide a service that is not adequately funded. You know, we were dipping into ComCare's coffer to come up with some of the administrative money for the administrative duties, and you know, really, an evidence-based practice should support itself. Should be worthwhile to the state to pay us a rate that covers every part of that evidence-based practice.
But if they don't,
then we stopped it.
Then we stop it, even though it's good for us, good for our community.
We stop the administrative
because we don't want to pay money ourselves. You know, I have a problem with that. But now, the first year they're going to have to do 25 cases, which is 8 per. For each worker, is that right?
Minimum, yes.
Minimum.
And do job development and participate in whatever community meetings and other meetings that are needed, and connecting with the traditional case managers, because they're going to focus on the employment. They're going to also need to coordinate care with others who are involved in this.
No, I get that, but that seems to be quite a low standard. That's 1 every month and a half.
We will do better than that. We always have. That's just the minimum requirement.
You're right. And then, so in 4 or 5 years when this money runs out,
my hope is that we will have identified barriers. The state will see what it actually costs to do this, and they've known from the get-go that it's been difficult to administer this program, and that the rate will be sufficient to cover what it costs to do this evidence-based practice.
well, do you think this project is important to the state?
Oh, absolutely.
Okay, then why aren't they funding it?
They are funding it. It's just not the rate that is available.
This program here, this money's coming from the feds.
I don't know why the state's not doing it on its own.
But do you think this program is important to the state?
I think all employment for people with mental illness is important to the state. It's part of the national outcome measures.
Right. Well, I mean, where do we draw the line? And we're helping people that have persistent illnesses and are less functional. I mean, you have the whole gamut. You have some people that are much more functional and would be better equipped to address issues themselves. I mean, where do we draw that line as far as?
I don't know the answer to that. I just know that when we affect these lives and get them jobs, their overall health improves, because one of the social determinants of health is having safe housing, having a job, making healthy decisions, having transportation.
Can we use our current personnel that's doing some of this stuff to address the same group?
They are doing it now. We're expanding this. We cannot get paid That group is being paid by a billable code through Medicaid that's dealing with people with a persistent and serious and persistent mental illness. That we will be getting the salaries of these individuals excuse me, paid for. So we don't have to worry about the fact that they don't have a medical card. So they're already doing this with another population.
Okay. I guess maybe I'm not following the rationale here, but the people that we're going to be helping with this one doesn't have a medical card, means they have access to some sort of medical care somehow.
Many of them are on a sliding fee scale for our service. They're using safety net clinics for primary care needs. They're uninsured.
What if we use current personnel to try and find jobs for the people who do not have persistent, then we won't get paid for it because the state doesn't reimburse for this. That's
right.
The bottom line.
Right.
And why don't they reimburse?
I don't know.
I mean, maybe that's where they draw the line of where you spend money, where you don't. I don't know. I'm trying to just try and figure that out. I mean, there's always going to be things that you could spend money on, but you have to draw the line somewhere, and I guess that's where they've drawn the line. That's all I have for now. Thank you. Commissioner Howell.
Thank you, Mr. Chairman. Can you tell us, is there a deadline to make this decision? I mean, we're potentially going to vote here in just a moment, but if we didn't vote today on this, is there a way we could, is there some deadline, some reason why we need to do this today? Or we have some time if we wanted to take some time?
I don't know if the deadline has to be today, but we're anxious to get started on this. The Mental Health Center in Garden City, and they have a couple of other communities they're serving as well, has already signed on and has started this initiative. The state got the money in late fall, and so the money's been available, and all it does is delay us getting started on this, and we'd like to participate in it.
Well, I'll tell you, I guess in my opinion right now, I have not had time to get through all the material that's been given to me for this meeting today, and I feel a little bit uncomfortable having to vote yes or no with that in mind. So, Mr. Chairman, I'd like to make a substitute motion that we would delay this decision for 2 weeks and put this on the agenda on the meeting, be 2 weeks away, if possible.
We have a motion. Do we have a second? I'll second that motion. Commissioner Unruh?
Thank you, Mr. Chairman.
We don't have a meeting in 2 weeks.
Okay. Meeting after that then would be my...
3 weeks?
Yeah, 3 weeks.
Commissioner Unruh?
Thank you, Mr. Chairman. I will not be supporting the substitute motion. I think, when did we apply for this, Marilyn?
We really didn't apply for it. The state applied for it last April. They had a very short turnaround. They asked us if we would be willing to be an implementation site if they were selected. We didn't even know they got selected until late fall. So we didn't apply, but we got notice in late fall that the state had actually gotten this money, and that's where this started.
Okay, so the state has received the money, and it's not as though they're opposed to this program. They're just saying, hey, we've got this resource, and we'd like to pass it on to you.
Yes, and for the reasons I stated. We had experience in this, we had good outcomes, and we have a very high population of uninsured people in Sedgwick County.
So the state supports this?
Oh, the state asked us to participate.
Okay, well,
yes.
I just wanted to clear it up. It seems to me that this is something that we have been doing. This is a little bit different aspect to it. We can use these resources to expand our service to the community where there is a real identifiable need. It's a program that helps our citizens who have a specific need. The state does support it. We can do it without property tax impact, which we're all very sensitive to. And it helps individuals. It gets businesses in the community involved, supports them. I'm assuming that they get some benefit from this also, besides the fact of just helping people who have a clearly unidentifiable need. We've all probably encountered these particular individuals when we've been in various retail establishments in our community. And we're probably all proud of the fact that they have a job and that they're contributing. And this grant process we're talking about now just simply allows us to continue to help people in the community. And it does no detriment to our budget. It doesn't create some sort of a situation that we can't continue. If at the end of the 4 years the grant money goes away, we're not able to do it, then we would just have to stop carrying out the program. But to me, I'm having a hard time understanding why we would not want to go ahead and be involved and help people through a program that we're skilled and able to do with resources that are provided to us at the request of the state, and people get helped in our community. So I'm not going to support the delay. We've been involved in this since last April, one way or another. We had plenty of backup material and discussion here. I'm ready to move forward with it. That's all I have, Mr. Chairman.
I'll say I'll be supportive of the motion. The commissioners have only been involved in this for about a week and a half, okay? And I've been the new guy in the past, and I've had lots of questions and been in the position of not having enough information or all my questions answered, and have asked for postponements, and they've been granted in the past. I think it's important that every commissioner fully understand the issue, have all their questions answered before they vote. Otherwise, I think that's a disservice to their constituents. So I'll be supportive, and I will respect the wishes of my fellow commissioner to ensure he gets all information he feels necessary to make the decision. Commissioner Peter John.
Thank you, Mr. Chairman. I've been briefed on this, and I've taken a look at it, and I'm certainly comfortable with being in a position to proceed. Having said that, if one of my colleagues would like a little bit more time, I'm very sensitive to the fact that in the past there have been a number of occasions when commissioners have sought additional information, and unfortunately they've been voted down. And so I am going to be supportive of this motion today, but I obviously anytime we have grants coming up, there are concerns going forward, but I'm comfortable in terms of proceeding, but I'd also like my colleagues to be able to feel that they're comfortable and will be able to get all their questions answered, and we make sure we dot all the I's and cross all the T's. So I will be supporting the motion, the substitute motion in front of us this morning, but I did want to explain my reasons for the record. Thank you, Mr. Chairman.
Commissioner Norton.
Well, it seems to me like a really good idea. If the state wants to use us as kind of a guinea pig to see if this works and can be modeled throughout the state, and we'll be testing it. There'll be research done through KU and assessment. Garden City, kind of a western rural area, is modeling it and trying to test it too to see if it has bigger applications at the state. I'm sure the state is tickled that they've got a funding mechanism to be able to do this before they invest huge dollars of state money and maybe local money to test to see if this evidence-based program brings about the results that they hope for. So I'm willing to move ahead today. I don't know that we need to delay. It is a test in 2 different markets, and that's the way I see it, of an evidence-based program. And along the way, our consumers, our clients, our citizens bear the fruits of that, particularly those that are underserved, insured, and have difficulties in the workplace. So I'm going to be for this today, and I don't see why we need to delay it all. That's all I have.
Madam Clerk, are you clear on the motion?
I am.
Call the vote, please.
Commissioner Unruh?
No.
Commissioner Norton?
No.
Commissioner Howell?
Aye.
Commissioner Peter John?
Aye.
Chairman Ransall?
Aye. Motion passes 3-2. We'll revisit this item in 3 weeks.
Thank you.
Thank you. Madam Clerk, next item, please.
Item D, consideration of a grant in the amount of $2,287,589 from the Kansas Department of Health and Environment for services provided at the Sedgwick County Health Department.
Good morning, Commissioners and Board of Health. Adrienne Brunlitz, Health Director. Before you is our annual aid to local application to the Kansas Department of Health and Environment. We have received this funding for well over 30 years, and it's the primary way that state health departments funnel state and federal money to local health departments so that we can do the work that we do. This application covers many of the grants awarded to the health department and supports our mission to prevent disease, promote wellness, and protect our community and residents from health threats. This year we are requesting $2,287,587. There is a match requirement for us in both in-kind and hard match, which we meet without asking for additional local dollars. This application funds portion of several program areas along with portions of 33 positions. This funding helps support public health infrastructure, chronic disease risk reduction, family planning, maternal child health, mobile immunization services, sexually transmitted disease control, and our public health emergency preparedness program. Without this funding, many of our programs would be drastically reduced or the services not able to be provided at all. We are requesting an overall increase of $153,114, or 7.2 above the funding that we have received thus far. Before the current grant year ends, we do expect to receive an additional $78,000 for family planning, which will decrease our additional funding request to approximately $75,000, or 3%, which is an increase in pharmaceutical costs and personnel costs. This contribution from the Kansas Department of Health and Environment is a foundational piece for many of our health department programs. It allows us to continue to work towards improving the health status of our community by assuring that our children are immunized, our most vulnerable women receive well women checkups and education about how to stay healthy during, before, and in between pregnancies, and our high-risk teens receive information about pregnancy prevention and prevention of sexually transmitted diseases. These programs help to strengthen the health of our community, and I recommend that you authorize the chair to approve this application and sign all related documents, and I'll be happy to answer your questions.
Commissioners, you've heard the proposal. Do we have any questions, comments, or motions?
If there's no other questions, well, I see a light going on, so I'll wait.
Commissioner Peter John?
Well, thank you. Could you go into the details in terms of the in-kind match that's required and how that's different from the grant we're operating on for this year, please?
In-kind match, like for our maternal and child health funds, in-kind match, we're using our volunteer dental hours for the in-kind. So it's not actual hard match as far as having a position salary as a match, but volunteer hours.
So the entire in-kind match is basically determined by volunteer hours contributed by
well, the volunteer for the dental volunteer hours is determined on what their hourly rate would be, along with the dental hygienists, other volunteers. So just the services that they provide and what they normally would be reimbursed.
Okay, and it's strictly folks involved on the dental side of this grant, because this covers a lot more than dental issues, as I understand it.
There are three areas where we have to have match. The one is the MCH portion, which is all in kind or the dental hours. The other is the chronic disease risk reduction, and we have to have a 25% match for that. That is a combination of hard and soft. It's about 25% of staff salary, and then the other are indirect charges, tobacco-free Wichita, and maternal smoking task-free volunteer hours. And then the third piece is family planning, and we have to have a 40% match for that, and that is a hard match where it is one of our ARMP's salaries and then some indirect costs.
I'm sorry, Aaron P.
One of our registered practitioners, it's her salary, and then indirect costs.
Thank you.
So on the family planning, we're actually asking for $30,000 more than last year because that 70 was included. So we'll have an extra $12,000 in match that'll need to be budgeted for next year.
Which we have included, because the family planning has a 40% match, so yes.
Right, for next year. We'll have a $12,000 match.
Yes.
Beyond what we budgeted for this year, we'll add that to next year.
That is correct, which we do have.
Commissioner Howell?
Yeah, thank you, Mr. Chairman. So just to summarize, what's the total value of this entire, I think there's 9 different aspects to this grant. What's the total value of the application? We're asking for how much again? Total?
The total value of this application is $2,287,589.
Okay. I am curious. I'd like to talk about a couple elements within the umbrella. There's a lot of details in this, and again, let me just point out to the room and to my colleagues here that once again received a very complex proposal with 6 days' notice before this meeting today, and I guess that bothers me. I think that having 2 weeks' notice or 2 weeks with the information for us to read the backup and ask questions and do research is reasonable. And again, this is probably the most complex package I've received so far in my time on the commission bench. And so having 6 days to get through this has been a challenge. I've spent a great deal of time on this, and I'm really not satisfied that I have all the answers just yet. So with that in mind, I want to ask a couple of questions about some of the things within this overall package. And so let's talk about a couple of these. The CDDR funding that we have here, which is the second item on the breakdown. Can you talk about how is that different than the grant that we turned down on, I think it was January the 21st. We turned down a grant that the Medical Society took that up. Okay. How is this different than that?
The grant that the Medical Society has taken on was about focusing on chronic disease reduction around obesity, heart disease, and stroke. And where this is a chronic disease risk reduction, it is focused on the effects of tobacco and how tobacco use can lead to chronic disease.
Okay.
So this funds 2 tobacco educators.
Okay. And I think you and I had a discussion, I think we did, about tobacco harm reduction and the idea that tobacco itself is a very broad term that has different risk levels with different forms of use and such. And so their focus is on the entire broad topic of tobacco in general. Is that correct?
Yes, and this isn't so much going out and telling people that they shouldn't smoke. This is about working with entities like WSU to go, if they want to go smoke-free on their campus, which they're currently looking at and have engaged us in that process of walking them through how they would do that, how they might engage their students. We educate medical providers on the 5 A's so that they can then talk to their patients and their pregnant moms when they come in about reducing smoking and quitting while they're pregnant. So we're out in the community helping people understand the risks with using tobacco, and then working with entities like the smoke-free apartments when there are apartment complexes that want to go smoke-free, that we help them navigate through that process as well.
What is the position of this effort with respect to e-cigarettes and that type of tactics to move someone away from tobacco use and onto maybe less risky or perhaps even no risk? I think I have not seen a single study yet that I think is a legitimate study that talks about the risks of e-cigarettes necessarily. For the record, I don't smoke and never have smoked. I'm not really in favor of that, but I'm just trying to be logical about this decision today. So what is the position of this effort with respect to e-cigarettes?
Well, we are out there, again, focusing mainly on the effects of nicotine and the products on people's health long term. So we don't advocate that someone uses one over the other, but just being aware of the effects of what they do choose to use.
So in your opinion, nicotine is a problem? That's what you're trying to get people to move away from nicotine. Is that the concern?
It's helping them understand that the chronic conditions that nicotine can create. Yes.
Okay. Do you understand the idea that cigarette smoking has a lot of carcinogens in the smoke that leads to lung cancer, and that has been one of the highest risk habits or behaviors people might take on would be the idea of cigarette smoking, and that these other forms of tobacco use and e-cigarettes are not even really comparable to that. Would you agree with that?
I think there's still a lot of research that's being done on those e-cigarettes and the risk involved or not with using those.
Okay, but right now we don't have any evidence to indicate that they are a problem. Is that true?
Well, not that I have with me this morning, but I can definitely go and look into that for you.
I have spent some time looking at that, and right now I'm not convinced that there's any legitimate evidence to indicate that e-cigarettes have anywhere near the same risk factors of cigarette smoking. In fact, I would actually liken that even to other forms of tobacco use are not the same level of risk as cigarette smoking itself. And so I'm just questioning the overall strategy of that part of this grant. And have we received this particular CDRR grant in the past? This has been an effort it's been ongoing here?
Yes, it has been a number of years, at least 10.
How many people do we have employed as a result of this particular part of our grant?
2.
2 people. And so they just go to apartment complexes and encourage them on how to create smoke-free apartment complexes and that type of thing. How do they I'm trying to understand exactly what do they do in their job that is...
Well, they're part of the Tobacco-Free Wichita coalition, and oftentimes the community looks to the health department to provide information and guidance, and so we will be contacted by organizations, again, such as WSU looking at smoke-free campus, and they begin working with them on how to gather the right people to the table, any policies, information they may need to share, just a whole, it seems like it's a simple process of if you want it to happen, just make it happen. But there's a lot of pieces and individuals that are affected by choices. And so instead of just going in and putting the hammer down, we help them look at who they need to engage and just the processes to go through that. Okay.
I guess I would be surprised if there's a large population out there that does not understand that cigarette smoking can cause harm to their health, and so I guess I'm just questioning the overall usefulness of this CDRR part of this proposal. I don't agree at all that the tobacco as a broad term has the same risks across the spectrum of use. I think that the cigarette smoking specifically ought to be the focus, but that's not what this does. And I think the e-cigarettes actually is part of the solution. If we would simply someone who has a problem and wants to quit smoking, as a state legislator, I sat through the hearings on some of the topics that came before us, and I remember one of the statistics that was presented to us was the success rate of all the patches and the gum and everything that we can throw at someone trying to get them to have all the help and assistance they need to stop smoking. For people who want to stop smoking, was 7% success rate, 93% failure rate, and so to me this is just the messages in my opinion are tobacco's bad, e-cigarettes are bad. And you're telling people things they may already know about cigarette smoking itself. And so I guess for me personally, I guess I would not be supportive of the CDRR part of this grant. I would like to move my attention now towards another part of this, and that is I can find it here. Okay, it's on the bottom of page 1 of the breakdown here. It's actually take that back, that's not right. It is, okay. Page 3, the Personal Responsibility Education Program funding, the PREP funding. Now, this is money that we use entirely for USD 259. Is that correct?
The PREP funding has a couple different pieces to it, and one is to the 9th grade students, yes, in the USD 259 district.
Is there any other school district that benefits from this?
Well, we also go outside of the school district as far as places like Wichita Children's Home, Girard House, to provide education on teen pregnancy prevention.
Okay, and you're primarily focused on the adults that are interfacing these students and trying to give them the education they need to transmit that education forward to their students. Is that correct?
Yes.
So you're not dealing with students directly. You're dealing with the teachers or the administrator, whoever it is. Okay.
Both, because so we are modeling by teaching the curriculum, and then the teacher is there, and then takes that over.
Wasn't this supposed to be okay? So let me understand then. So your goal is to educate the educators, and then they're going to continue this program and with having best practices, continue this forward. Okay.
That's true.
Okay. So how long has this been going on so far for this part of the grant?
How long have we had that? This is year 4, and we have 1 more year left.
So this is a 5-year plan?
Yes.
Was this originally a 3-year plan?
The state had said this last year would be the last year that the funding would be available, but they extended it 1 more year.
Okay, so I'm trying to understand. So in 3 years, these people have had this in their presence for 3 years so far, and they don't have it. They haven't got it. They don't understand exactly all there is to know about how to teach this stuff after 3 years worth of effort. And so we think that 4th year, maybe a 5th year would be more likely able to help them further than we already have helped them.
Well, we only have 2 educators really focusing on this curriculum, and so there are a lot of 9th grade classes in USD 259 to go to. And then part of the prep is also a be proud, be responsible for the pregnant teens and teen parents in the schools to help them with further preventing further pregnancies or STDs, and then with parenting. So it's more than just that piece of it, but there are many 9th grade classes.
Okay, I guess my thought is after 3 years worth of interfacing these teachers, that if they haven't learned how to do this at this point after 3 years worth of effort, let me ask. So what you just said a minute ago, we're finding new audience all the time. The audience we've not interfaced all of the different various classes across the.
That's correct.
Okay, so
that's correct.
The reason to continue this would be, in your opinion, because we have more folks we haven't not had a chance to get to yet.
That's correct.
Okay, so are you going to be able to get to all of them in the 4th year or the 5th year?
That is the plan, yes.
Okay. But originally it was 3 years. Did we not have a plan to get to all of them in the first? I guess how do we get here?
We only have so many staff that we can dedicate with the funding received. So again, with the focus being on 9th graders, we're not continuing to educate the same teacher. It's different 9th grade teachers through PE. Actually, it's the PE teachers.
Do all the school districts have something like this that is assisting them with this type of training?
I do not believe so, because we've had requests outside of USD 259 to come in and provide the services.
Okay. I guess I'll make a comment here, and that is, the State Board of Education sets curriculum standards for the entire state of Kansas, and we want local control of our schools. We want parents to be involved. We want school boards to make decisions for the best practices for their own schools. And we've got a funding stream that includes both local, state, and federal funding. I'm just a little surprised that we have funding such as this, which is outside of anything else. As a state legislator, I wasn't even aware that there's other types of funding that goes around that entire process, that entire revenue stream, and provides other resources and other spending within our schools. And just a matter of fairness, if nothing else, I think that all schools ought to have the same resources available. I don't know why it is that we would not provide those services or those educational ideas, I guess, through the education system that's already in place, through the State Board of Education and our school districts and our staff that's out there. I don't understand why this is a necessary spending to provide education when our educators have that charter to do that already, and our parents and school boards are engaged trying to provide that education that they need. But this is another element of effort that's outside of everything else in the entire state of Kansas. I guess right now I'm a little bit concerned about this part of this grant, so I'll just stop with that. Thank you.
I have a few comments about that. Oh, yeah, I forgot to ask if anyone in the public wants to speak on this item. Thank you, Commissioner. Seeing none, I remember very clearly being told when this, I voted against this the first time because I didn't think it's something we should get involved in, and certainly not something the federal government has a role in funding. But we already have a education system that is capable of providing sex education, so I opposed it then, but I remember very well being told this is a 3-year deal, and I thought it was a type of thing where we train the trainer, where we train some people, we get them going, and then they can self-sustain themselves. And now we're being told it's going to go on and on and on. You know, at some point, the school district needs to be able to take this on themselves, and I share Commissioner Howell's concerns. I'm not going to be supportive of continuing with this. Like I say, they've been given 3 years, and they've got to find a way. If they want to continue this particular curriculum, they can sustain it themselves or use another curriculum if they so desire. I'll also say, so some of these others, you know, as we look forward, the family planning, I would just as soon keep our funding levels at the same levels. If we increase it $30,000, that's another $12,000 in a hard match that we have to spend next year. And as we go through all this budgeting and stuff, I'm going to be reluctant to increase our spending until I have a plan, till I've been presented with a plan that addresses some higher priority needs, like Judd Riddell's Boys Ranch, the Cold Mix Road program that we need about $50 million for over the next 17 years. So I'm going to be looking at pinching some pennies here and there and making sure we're spending our dollars on high priority things, and I don't think it's necessary to expand that. I have similar concerns about the chronic disease reduction program. It says here, though, it does say tobacco use, but it also talks about physical activity, nutrition, and chronic disease self-management. So that stuff isn't included.
It's a small piece of that, but their primary focus is on tobacco education.
Okay. I thought that there was some part in it there, because I've read some document from the state of Kansas on this issue. I'm not convinced the strategies we're using here are the most effective and something that we should be putting matching dollars from. This is another opportunity to save dollars. If WSU wants to go smoke-free or an apartment building goes smoke-free, I think they can do that. I'm not sure they really need us to tell them how to do that. And I'm concerned that we feel like we need to educate physicians on the dangers of smoking and this, that, and another. I'm not sure these are effective tools when it comes to smoking, and certainly when we talk about physical activity and nutrition and things like this, we already turned down a grant. I mean, there is going to be some duplication of effort there. So I'd be fine with withholding funding on those things and saving the dollars and putting our local dollars on other programs that I think are a higher priority, to be honest, and might be used more effectively. So my concerns, I have concerns for a variety of reasons. So, Commissioner Peterjohn?
I'd like to get into a little bit more detail on the tobacco side of the equation, and in terms of ingesting substances and more broadly, because obviously what some other states have done, and we're likely to have some discussion certainly between now and the April election. I don't know what we're going to do in terms of the issue on whether we have an issue on using a municipal initiative concerning marijuana on there. But when you say tobacco, is it limited strictly to tobacco, or is it drug ingesting and more broadly, or would it include other substances like marijuana, or that would fall in the illegal category, at least at the moment?
This is focusing on tobacco.
Just tobacco. Well, because frankly, as a person who has run more than a few 10Ks, marathons, and triathlons, I'd like to, if we're going to be focusing on health-related areas, I think there's a lot of things that young people can inhale that would definitely be detrimental for them, and frankly for some chronologically gifted folks too. So I appreciate that clarification. Thank you, Mr. Chairman.
Madam Clerk, do we have a motion?
We do not.
Okay. Commissioner Unruh.
Could I add a couple clarifying comments?
Yes.
On the PrEP grant, the school district approached us a number of years ago because they do provide sex education in the schools, but they found that it wasn't being provided consistently. There were varying levels of comfort levels of the educators, and so they would skip portions of the curriculum. So they requested that we come in and kind of mentor, provide that training to help increase their comfort levels so that we could then train the trainer and then they could continue and effectively be able to communicate to reduce STDs and teen pregnancy. And then with the family planning additional money, that $30,000 isn't to increase services. The cost of Depo-Provera has skyrocketed, and I don't know, what the rhyme or reason is to the pharmaceutical cost increase, but that $30,000 is primarily to cover pharmaceutical costs.
Well, let me, as far as the PrEP funding, that doesn't help me be more supportive. If the school district has an issue with sex education being uniform and consistent, I think they ought to be able to solve that issue themselves. And the fact that they don't seem to think that they can is troubling. So, every time they have a problem, they can't look outside; they've got to solve it within. And I mean, that only exacerbates the problem. Commissioner Unruh.
Thank you, Mr. Chairman. I just need to clarify one thing. This grant application is due March 16th.
That's correct.
So we are on a deadline on this grant.
Yes, we are.
And this grant is, according to our backup material, says it's used to support 32 of our health department employees.
Yes.
Okay. That's all I had, Mr. Chairman.
Well, I see. I might also point out that with respect to the chronic disease reduction program and the smoking initiative, the things that I've been told about, I don't think are going to be all that effective. And I'll also point out there are a lot of private sector entities that do promote smoking cessation, which I think would be much more effective than some of the things we're trying to do. But Commissioner Unruh?
Mr. Chairman, if now's an appropriate time, I would make the motion. I would move that we approve the application of the grant and take the staff's recommended action.
We have a motion.
We do.
Do we have a second?
We do.
Oh, Norton. Okay. Commissioner Howell?
Mr. Chairman, I'd like to make a substitute motion that we would accept I'd like to modify the motion with a substitute motion. Everything my colleague just said, but I would like to subtract the CDRR and the PREP portions of this grant, and that's my substitute. Thank you.
Second.
I'll just ask: is there any possibility you would add your motion to reduce the family planning funding by $30,000? If not, that's fine.
I would like to not do that at this time.
Okay.
Thank you.
I think, I'm not sure, Commissioner
Unruh. The two items you meant, thank you, Mr. Chairman. The two items that were mentioned to eliminate were the CDRR,
yes,
which is chronic disease risk reduction, and the other one was
the PrEP, PREP. These are the two items I basically spoke about. One of these deals with the issue of trying to target tobacco use. And the other one has to do with providing some resources to our educators on sex education, I guess. So.
Okay, thank you. I just needed that clarification.
There you go.
Commissioner Norton?
Well, I'm not going to be in favor of the substitute motion. I have a hard time with everything I've studied over the years to eliminate anything about tobacco. It's not just about smoking. It's about anything oral that you put in your mouth, which we're finding more and more causes throat cancer and mouth cancer and tongue cancer and many other things. And I think the more education, the more that we can just keep pushing that as a health issue in our country, the better off we're going to be. The idea that everybody knows about it and we can stop is not true. Everybody knew about measles, and we needed to get rid of it back in the 50s and 60s, and we did. And now we're back into the soup with measles. Everybody doesn't know that measles will come back if you don't immunize your kids. So I think it's an ongoing quest to discuss public health with the masses, and that's what public health is all about, population health. And when it comes to sex education, I think there's 3 prongs to it, which is why the schools are involved. And the schools try to impart knowledge about just anatomy, about how it all works, what the physiology of sex is. But tied to that is the health implications of not having safe sex, of STDs and everything that goes with that. And then finally, there's the parental and community value of the morals of sex. And if you try to put those 3 all commingle together, it becomes very hard. And I'm a believer that the health department does have a mission to try to talk about the health implications of sex. Now, the schools have to know the knowledge of just how sex works and how it's a physiological thing that every human being ends up dealing with, and how do you talk about that in the context of biology. And then finally, you know, parents in the community and the churches and all of us have a value to talk about the morals of sex. And everybody has different beliefs and value structures about that. They all get commingled. But at the end of the day, for me, the schools teaching knowledge and then the health department helping them describe the health implications are very important. So I'm going to be supportive of both of those and will not be supportive of the substitute motion.
Commissioner Unruh.
Thank you, Mr. Chair. Adrian, can we pick and choose which categories we want to apply for? Is this a unified whole, or can we?
The only unified piece on here is the maternal and child health package.
Okay, thank you. So the motion as it stands could be workable. I mean.
Yes.
Okay. Well, I'm glad to have that bit of information, but I think on this issue I'm going to yield to the professional expertise of our health department staff and their leadership in how to best deal with these community health problems. And so I would prefer that we apply for the grant as recommended by staff. So I won't be supportive of the substitute motion, but should that motion go forward, I'm pleased that we'll at least be able to continue the operation of our health department. So that's all I have, Mr. Chair.
Commissioner Howell.
Thank you, Mr. Chairman. Just a question. If USD 259 wants to ask for this assistance, would they be able to approach the health department and perhaps provide the money to get these services? Otherwise, would they be able to fund it from their funding stream and provide money to the health department to get that expertise within their schools if they felt like they needed that?
I don't know, although I believe they're looking at their own budget cuts, but I do not believe so.
Well, I don't have the exact number, but I believe that the last budget I looked at from USD 259 was about $630 million for about 50,000 students. And this grant we're talking about today is a separate funding stream to provide $158,000 to employ 2 people from the health department to provide education to our education community. I guess if they feel like they need the help, and I do trust their ability to educate, they can do a great job. But I guess if they feel like they wanted to have the health department's input, they could provide some funding to bring that expertise in if they felt like that's what they needed to do. But so I guess with that, I would just continue with my substitute motion. Thank you, Chairman.
Commissioner Peter John.
Thank you, Mr. Chairman. I'm going to be supportive of the substitute motion today. Wanted to just add a little bit in terms of the record because I agree with some of the earlier comments I heard in terms of when the Commission met earlier this year to establish priorities. There were certain directions that we gave at that time, and I'm uncomfortable with some of the increase in the local funding side of it. I do want to support the idea in terms of the health grant. I'm glad that the state is involved in some of the key areas where the health department is operating, but my concern today is with the increase in the local spending side, so I will be supporting the substitute motion. Thank you.
Thank you. I'll say, with respect to the such education funding, this wouldn't be happening if we didn't get the money from the federal government to begin with. Okay, so if the school district wants to continue, then they can find it in the budget and they can fund it. I think that's more than appropriate. We should have never gotten involved to begin with. I believe the school district and the teachers in the school district are more than capable of addressing this issue without our assistance. And with respect to smoking cessation, I'll make it very clear, I don't support smoking. I support smoking cessation. I grew up with a variety of smokers in my household. My mother died at the age of 56 because of lung cancer from smoking. But I also don't believe that the sort of things that we're doing here are I don't have any evidence that they're effective, and beyond that, there are plenty of initiative in the private sector to address this issue, and I think, and I fully support those initiatives. So I'll be supportive of this motion. Madam Clerk, call the vote.
Commissioner Unruh?
No.
Commissioner Norton?
No.
Commissioner Howell?
Aye.
Commissioner Peterjohn?
Aye.
Chairman Ransall?
Aye. Motion passes 3-2. And by my calculations, that means we did approve approximately 80% of the funding, 86% of the funding request, just for the record. Madam Clerk, next item.
Item E, report of the boards and bids of contracts. Regular meeting on March 5th, 2015.
Good morning, Mr. Chairman and Commissioners. Joe Thomas, Purchasing Director. On March 5th, the Board of Bids and Contracts had a meeting which resulted in 5 items that we'd like for you to consider. Item number 1 is road improvements for public works. The recommendation is to accept the low bid from Votes Parga Construction, LLC, in the amount of $181,981.45. Item number 2 is street improvements for public works. The recommendation is to accept the low bid from APAC Kansas Incorporated Shears Division in the amount of $3,055,882.21. Item number 3 is on-call mailing services for various county departments. Recommendation is to accept the overall low bid from Mail Communications Group at the rates listed for 1 year with 2 one-year options to renew. Item number 4 is Community Service Capacity Development for SCDDO. And this recommendation is to accept the proposal from Starkey Incorporated in the amount of $141,600. And item number 5 is the Waste Tire Transportation Service for Environmental Services. The recommendation is to accept the low proposal from Champlin Tire Recycling Incorporated for $90 per scaled ton. I'll be happy to answer any questions you may have, and I recommend approval of these items.
Commissioner Howell, do you have a question?
No, I just wanted to make a motion that we would approve the recommendations of the Board of Bids and Contracts.
Second.
We have a motion and a second. Any discussion? Madam Clerk, call the vote.
Commissioner Unruh?
Aye.
Commissioner Norton?
Aye.
Commissioner Howell?
Aye.
Commissioner Peterjohn?
Aye.
Chairman Ransall?
Aye.
Thank you, Commissioners.
Next item.
Consent agenda.
Commissioners, you have the consent agenda before you, and I recommend you approve it.
Move approval of the consent agenda as presented.
Second.
Call the vote, please.
Commissioner Unruh?
Aye.
Commissioner Norton?
Aye.
Commissioner Howell?
Aye.
Commissioner Peterjohn?
Aye.
Chairman Ransall?
Aye. We're now to the other portion of the meeting. Commissioners, do you have anything to say for Commissioner Peterjohn?
Well, thank you, Mr. Chairman. I'd like to report to the public what I reported to a lot of the folks who are currently in this room yesterday. Last week, I attended a meeting that had been called by the city to discuss the possibility, or more likely the probability, that we will fall into non-attainment for air quality, and that this is going to require, especially if the feds tighten down the limits, and they've apparently ratcheted. I did find out that the ozone air quality limits have been tightened from about 120 parts per billion back in the 1990s, and they've been ratcheted down, and there's some discussion about making them as tight as 70 or 65 parts per billion. And with the spring burning, and they monitor this only during certain hours of the day between the beginning of April and the end of October. So when we have some burn off on the Flint Hills in the spring, as well as sometimes ozone levels go up during the summer when we have a particularly hot day, there's the possibility, in fact, the probability, that if the tightened standards go into place, we're going to fall out of attainment and have to begin following a whole bunch of new edicts from EPA in Washington, and looking out at the air quality, I think we really need to look at this, because air quality is, in my opinion, a 24-hour-a-day, 365-day-a-year issue, and not just, as the feds are monitoring it, focused on certain times of the year and basically certain times of the day. But having said that, I want to try and get the community, as much as I can through this medium, be able to let folks know that this is a challenge in front of us. There have been some community meetings. Commissioner Holland, Commissioner Unruh were with me at this meeting last week. I don't know if they want to add to these comments at all, but or amplify upon them. But I think there's going to be meetings in the future, and I urge the public out there that this is likely to have impacts on whether it's certain businesses, on how they operate and what they do. And there's certain things we can do to try and lower that number, but I think we're at a point where we're getting to background levels for certain times of the year for this part of the country, and I'm not going to go into more detail at this point, but I did want to get this onto the record for the discussion this morning, Mr. Chairman. I'd also like to point out the fact that the wonderful weather we're having this week, great opportunity to enjoy some of Sedgwick County's best events, whether it's the zoo, Exploration Place. Some wonderful things out there, and folks ought to take a look at it. And I'd also be remiss, Mr. Chairman, if I did not mention that March 11th is an important day in American history, and I want to share why, because we're just coming out of the winter season, and on March 11th, 1888, one of the worst blizzards in the United States history hit the northeastern part of our country, killing 400 people. I mean, think about that. We've talked about the Udall tornado, 150-some people got killed. More recently, we've had tornadoes down in Moore, Oklahoma. And, of course, we've had major tornadoes here, and Commissioner Norton is our expert in that regard. But I want to think about this in terms of a blizzard that would kill 400 people. I mean, it's equivalent of like a hurricane. Now, on March 11th, 1918, we also had a momentous and not a good date. The first cases of what became called the Spanish flu were reported, ended up killing 600,000 American citizens and tens of millions worldwide. And that pandemic in 1918 started on this date. And on a much more positive note, on March 11th, 1960, NASA launched Pioneer 5 that began one of the unmanned probes, and there's a whole bunch later, Viking, Voyager, Cassini, Deep Impact, that have followed in their footsteps. On March 11th, 1960, NASA got us out of the world in this category. So, Mr. Chairman, I wanted to add that for the record this morning. Thank you.
Thank you, Commissioner. I'd like to add a couple things. A couple weeks ago, in one of our staff meetings, we made some organizational changes that will save us $18,000 a year in rent. that's something that, since it was in the staff meeting and wasn't covered in the press, the public may not know about, but I know there are people interested in knowing about our efforts to reduce spending and save on costs, and so that's another example of some of the things, of something that we've done recently that you may not be aware of. Additionally, I've still got to get some questions about Judge Riddell's Boys Ranch. In our budget retreat, we did instruct staff to include appropriate funding for Judge Riddell's Boys Ranch next year, and it is the will of the board to reopen a Judge Riddell's Boys Lake Ranch either there or perhaps in another a location that would provide the same results. So I've had some questions about that. That's been an ongoing issue, and some people have inquired about what the status is and are we doing anything about that, and we are. The issue is, however, because some of the decisions we've made in the past, got rid of a lot of equipment, shut it down, et cetera. It takes time and some money now to go back and restart that. So, but we are in the processes of developing a plan and funding for that, and hopefully can address that next year, if not sooner. So I wanted to get that on the record. Commissioner Peterjohn.
Well, thank you, Mr. Chairman. If we're past other, for all my colleagues, I'm going to make a motion that the Board of County Commissioners recess into executive session for 15 minutes to consider consultation with legal counsel on matters privileged in the attorney-client relationship relating to legal advice and preliminary discussions relating to the acquisition of real property for public purposes, and that the Board of County Commissioners return to this room from executive session no sooner than 10:50 a.m.
We have a motion, and I'll second. Madam Clerk, call the vote.
Commissioner Unruh.
Aye.
Commissioner Norton.
Aye.
Commissioner Howell.
Aye.
Commissioner Peterjohn.
Aye.
Chairman Ransall.
Aye. We're now in executive session. back from executive session. And for the record, no binding action was taken. Commissioners, managers, any further business come before the commission?
No, sir.
Seeing none, we're adjourned.